Well, as you know, the country is already beginning to move ahead with giving out the fourth vaccine, which is the Pfizer vaccine. But it is always good. We've always been from the first wave. We have been on top of doing research into how these vaccines impact us on the short and long term. And I believe that, this new research trial with Moderna, the idea is to try and find out if people who had 3 Pfizer vaccines and add a fourth Moderna vaccine will actually have an opportunity maybe to elongate, the value of the vaccine. Because as you know, it starts to wane between 4 and 6 months, depending on your age and depending on a lot of other factors. If you're immunosuppressed, if you are healthy, if you have background, problems with your health. We're doing it strictly on healthy people to try and maximize and understand the probability and the efficacy of the vaccine altogether, whether it's Pfizer itself or whether it's Pfizer and Moderna.
Now, on some of the pandemic issues right now, what's the status of Sheba's corona wards in terms of capacity, staffing, fatigue? What are you seeing in the hospital?
So right now, actually, as has been reported, Omicron has not had a big impact on the hospital as of yet. We have very, very few sick corona patients. In fact, we have 0 critically ill corona patients at this point. We are preparing just in case the wave starts creating a problem. The biggest problem really right now, and something that I spoke about on I-24 a few months ago, I predicted that if that flu and corona had hit together, it would create a tremendous challenge for the entire healthcare system, including Sheba. And that is a problem right now, not necessarily with corona, but right now we're battling a lot of people who have the flu. And, if Omicron hits any harder, it will impact the staff and it will challenge the entire Israeli healthcare system.
And from your perspective there at Sheba, Steve, what's been learned or adapted in the hospitals from the previous waves? Do you feel you're better prepared today?
We are always, as you know, as I've mentioned earlier, is that we're always doing research. And, we have been sharing this information with a lot of other hospitals around the world. It's the same treatment protocol, but now we're getting better drugs to use. As you know, the Pfizer oral vaccine is now in place. It's not a vaccine, it's actually a pill to prevent, quickly deteriorating patients into a critical situation. But the pills are one, new weapon in the, versus the Omicron virus. We also will have the Merck pill as well. So as we move from wave to wave, we are getting more and more weapons to use against the virus. The problem is that we never know from virus to virus, from new variant to variant, what will work and what will not work. And that's the great unknown. And that's why we continue to do research.
Steve Walz, thanks for being with us from Sheba Medical Center. Thanks for all the important updates.